Hi, today I would like to start discussing about uh, LRW of OET modules. In that, I am going to discuss only listening module. Listening module, when you think of OET, it is having like 42 questions and 42 marks. And if you are getting a 30 marks of that, and you will be getting a B grade. So that means in this video, I just want to give you a brief explanation that in which area you can fetch marks highly and in which area the difficulty is more and you need more practice. That is what I am going to discuss, and the practical knowledge only I am going to give in this video. So hi, this is Anita. Welcome back to my channel Ages Kingdom. If my video is really useful for you, and please do like and subscribe and let somebody get benefited with your sharing. And come back to the topic, the listening module. When you think of listening module, this is the first module in OET exam. When you enter into the exam after your registration process, and they will ask you to hold your headphones and check that whether the clearing is good or not, is there any sounds are coming, and there's the accent is. So that's what we will do. So that's the first module, listening module. So in the listening module, what you are going to do? The first important tip I am giving you is concentration is very important. If you lose concentration, turning your eyes to somebody or some paper is fall down, somebody is calling. It's in that situation. If you are just turning your head or distracting your mind, and next continuation of your answers and questions also is very difficult. So the first tip which I want to give you for listening module is concentration. Keep concentrating. And before starting if your actual audio, they will give you a script. Just keep the script and just have a look of what are the questions they are asking and what answer they are expecting. In the listening module itself, when you are reading the questions itself, you will understand what kind of answers it will be. So if they're speaking about signs and symptoms, maybe they'll have fever, cough, cold, or something like that. So you, when they are pronouncing, so they are speaking about signs and symptoms, which one is best suits for this? And already they listed 4 5 symptoms. In that, which one is not written? That is what you want to pick. Then concentration is very important. So the first tip is concentration. Second one, don't distract your thoughts with the previous question and second question. You go with flow. You go with flow. Maybe a first answer, if you didn't find out in the final time and the final written answers, you can just check it once, and if whatever is suitable you can write it down that time. But now don't stick on with the first question and missing remaining answers. It is very difficult, so don't distract with your unanswered questions. Leave it like that and go with the flow. Second tip. And the third one is, in this listening module, answer is important, spelling is doesn't matters. That's a very important tip I'm giving. Answer is important. Suppose patient complains of I'm having diabetes, hypertension, cardiovascular, some other conditions and renal failure. He may miss hypothyroidism in the list. So when you are listening, these all things are there. What is missing? You need to pick an answer. Maybe in hypothyroidism, little spelling mistake is there also. If answer is correct, they will give you score. That's the third point I am telling. And the fourth point is, if on the flow, whatever you listen, you try to put it the shortcuts at least. Suppose they are saying cerebrovascular accident, you don't have a time to answer completely, because in the next question they are going forward and the tape will be going a little bit speed when the questions are increasing. So you need to think of it, okay, this, if I am writing this full answer, remaining 2 questions are in this, then use some shortcuts. Use some shortcut CVA. Then after the tape, then you can erase it. CVA means, because you are a healthcare professional, it is a cerebrovascular accident or it is some other meaning is there, so you can write it down. Use some shortcuts while filling the answers. Later you can fill it with complete answer. But don't leave with a shortcuts, you will not get scored. Okay. And other thing is, you need to write it with a good handwriting, legible handwriting. It should be legible handwriting, and it should be very clear. Very clear. And other things, guessing words. If you are writing, you just once again check your question, is that question is suitable for this answer or not, because most of the time we do answer, we heard something but that answer is not suitable for the question they asked is about investigation, but answer you are writing about signs and symptoms. Is that question and answer is opting each other or not, you need to think of it. And other thing is, you need to have lot of practice of model papers. There is lot of OET 2.0 materials are available in the net. Just take the printout and do repeatedly the part A sessions, because part A is having 24 questions. So out of 42, 24 questions are from the part A, and it is easy to answer if you do lot of practice. And this is possible only when you learn a medical terminologies very easily, medical diagnosis, medical investigations, and some of the medicine names, and some of the, like we can say, some short words they will say. So such all things you should be familiar with that. Then only part A is very easy. And other things, never in the script and what is played in the audio, those two may not be similar, because lot of synonym words they are using, lot of synonyms they are using. So synonyms means the word what is heard in the audio, that will be having a different word in the script. So you don't think that it is not heard, this word which I am reading now, it is not heard in the audio. This the script word and the audio will be having a similarity meaning, but the pronunciation and the word is completely different. That's why you need to learn lot of synonyms, lot of synonyms. Maybe they say that my blood pressure has raised. So in the pronunciation they will say, in the audio it is raised, but here in the pronunciation increased, or they say shoot up, or they say it was top of top of it. So such words when they are using, which one is suits for that. So synonym words you need to be very familiar in listening module. And other things, it is all about part A, 24 questions, two extracts will be there, and in the two extracts, extract 1 to 12 questions, and after that session is closed, again next session will be starts. It is conversation between the doctor and the nurse, or the nurse and the patient. So it is, the conversation starts like this, like, what's your name, what's your age, when it is started, your symptoms, and have been any time investigations, and do you follow any measures to reduce, or such questions will be continuously. So what patient is answering, the patient version answers will be written in the script. So that's why listen very very carefully what both are speaking, what a nurse or a doctor is asking a question, and what a patient is answering. Is that answers already listed in the script, or which answer is missing in the script? So that things you need to write it down. So the out of 24 questions, if you are able to write 20 questions also, I think you will get a more score from this two extracts itself. So this is about part A. Or then next about in the listening module, second session is part B. It is having a 6 extracts, like 6 discussions will be there. So doctor and the nurse, and the nurse and the patient, or nurse to nurse when they are shifting the patient, or when they are handovering to the next shift nurse, such conversations will be there. These conversations, literally I can say that all answers are included in the script. So it is your time to pick up which point they both are discussing. Three things they will discuss, but they will discuss one point specifically using some connector or using some strong word, like this need to be utilized. So suppose after post-operative, after surgery, what kind of care you have to give, they will mention three answers which are given in the question, below the question, but the three answers among that one they will make it specific, like however, although, but, like some connectors they will use it and they will say the right answer. So that is what I felt, and you need to concentrate very carefully which point they stressed out more. That will be the answer. That is about part B. You will be having a 6 extracts and 6 discussions, and each discussion will have one question with the 3 options. And the 3 options will be having similar meanings, and the 3 meanings options will be discussed by the speaker and the person who is discussing, and among that one will be answer. How you can able to trace out is based on your complete concentration and using of some synonym words. Okay, and next thing is part C. Part C is having again 2 extracts. It is extract 1 having 6 questions, and extract 2 is having 6 questions. That 6 questions, here you should understand part B, one extract is not related with other extract. One extract or one session has completed, one question has completed. Next time another topic will be discussed. But in the part C, you have to see 2 extracts will be there. Each extract will have 6 questions. They will discuss on same topic for 6 questions. They, that may be monologue or dialogue, they both will be discussing some topic, or only speaker will speak. So in that situation, what he is speaking is he will speak for 6 questions, and in that 6 questions, each question will have 3 answer options. The 3 answer options also will be discussed in the audio. But in this also, the critical thinking and good judgment is very very important according to your listening, which answer best suits for this question. This is all possible. I will give you, if possible I'll give you with an example, but this is all uh, the things which you need to understand I'm discussing. So only this class I'm discussing only listening module, and 2 extracts will be discussed in the same way with six questions. So total 42 questions will be there, 42 marks. If you get a 30 out of 42, and you will be qualified as a B grade, and B is important to enter into any country. This is about listening module, and already I explained about some of the important tips you need to follow in listening module. Thank you for watching. Do like and subscribe.